I'm Rohin Saroya. I'm one of the family medicine physicians here at Bayhealth. In addition to my family medicine duties, I also practice sleep medicine. So the reason I chose to go into healthcare and specifically become a doctor is that when I was younger, my family physician was a huge mentor to us. She delivered me as a baby, and she took care of me until I went away to college. When my grandparents came to Canada, where I'm from originally, she was their physician, and actually after they passed away, she came to the funeral. So it was really cool for me to see a family doctor take interest in care in a family from beginning womb to tomb. So one of the things I like all my patients to understand, first and foremost, I really value patient autonomy. I really value the fact that they're able to make their own decisions. I like to lay out all their options, whether it's something I would do or not. As long as it's reasonable, it's respectful of their wishes, I like to have them in control and engage in anything we do to manage their health going forward. So one of the things we see with a lot of younger folks is that, they have a little bit of a sense of that they're invincible. The problem is a lot of the chronic medical problems we have as we get older really do start to develop in our 20s and 30s. The reason we really should be seeing, your primary care doctor at least once a year for a routine physical is that we're able to get ahead, and if there is any of these conditions starting to brew and develop earlier on, we're able to get ahead of it. And these are little things that are going to benefit your health later in life. So when all my patients come in, no matter what the diagnosis is, I always like to let them know they have options. We always like to start off with more conservative approaches, right? But we can minimize any high-risk surgeries, any medications that do pose side effect risks. We certainly try and entertain that first. But again, we also like to lay out down the line what are the other treatment options, whether it's surgical, if it's medication, if it's lifestyle. But at least that way our patients are informed about what options are available for them down the road. In addition to being a family medicine physician, I'm also board certified in sleep medicine and recently joined Bayhealth to manage their sleep centers. So a bunch of conditions that we manage include obstructive sleep apnea, narcolepsy, restless leg syndrome, insomnia, and other rhythm disorders where people have trouble falling asleep at appropriate times. We spend almost a third of our life asleep. It's a crucial part of our life that often gets neglected. It's also kind of scary to think about that 1 in 3 Americans has sleep apnea. Most don't know about it. Sleep apnea plays a pivotal role in raising the risk for heart attacks, strokes, making depression and anxiety worse, and a bunch of other conditions such as atrial fibrillation. So really, if getting evaluated for sleep apnea is paramount for a lot of folks, making sure if you have this condition, it's taken care of appropriately in a prompt manner. Also, there is a sense of relief and just making sure if there's any thoughts or concerns you have it, knowing you don't have it, there is some utility in that as well. At the end of our visit with all of our patients, we certainly hope that they feel happy, satisfied, and all their questions answered. We want to make sure our patients leave our clinic more knowledgeable about their health, satisfied with the level of care they got, and understand that they can come back to us with any other further questions or concerns.